Thank you, Emma. Good morning to the brave ones. The others will get their punishment later. So, this is the Actuaries Institute's green paper, 2 years old, just had its second birthday, on mental health and insurance. It canvassed lots of different insurance applications. So I'm going to try and just extract what's relevant to the motor and worker schemes and leave aside the other part. But just a reminder, after a lot of thought and querying and research, we called out, I think there might be 7, really systemic difficulties in dealing with people with mental health conditions in the insurance setting. So what have we got there? Lack of relevant data. I don't know why it says relative, but there you go. The fact that we spend all this time on diagnosis, which has nothing to do with prognosis. Particular diagnosis, people's outcomes are enormously wide, and similarly, the correlation of outcomes with diagnosis is very, very small. You've got this reliance on self-reporting. I don't know if anything can be done about that, but it does make it extremely difficult. I personally think insurers are obliged to challenge the validity of claims, and in a situation where we're totally reliant on what a person says about themselves and how it's affected their lives, that's a pretty tough gig. The prospects are very unclear. Doctors have a pretty fair idea with your little prostate cancer what's likely to happen. But with most mental health conditions, especially the mild to moderate conditions, very difficult to predict the course. Many, the majority, have some sort of relapse at different times in the remainder of a person's life. Not all, but quite a high proportion. But how severe they're going to be and what sort of outcomes they're going to be is quite unpredictable. You get a lot of comorbidities and substance abuse, makes the whole thing more complicated. Should we compensate people for their self-medication of alcohol? And a real tough one for everybody is that the prospect of financial compensation does influence some people's behaviour. Might be a little bit politically incorrect to say that, but I believe that it's true for probably a majority of individual people. Not everybody, but more than half. And then, the claim process. A wise man once said to me, if you've been in this workers' compensation system for 2 years, you're guaranteed to be mad. It's a tough old gig. And clearly, when you have a mental vulnerability, that claim process can be harmful. And the regulatory system just is not designed for situations of this kind. I'll be happy to elaborate on that later, but I'm strongly of the view that, particularly in workers, that a different product and service design is needed for mental health conditions than for physical conditions. So let me move on. Now, I'm going to give a little scorecard, my own personal scorecard, but there has been so much activity, or at least so much talk and so much activity, that there's a lot of stuff that goes on that I don't know about, and I assume that most of us don't know about. So I want to collect up a little sort of inventory of initiatives that people are aware of. So as I'm going through, if you know of something that's been done that can be mentioned in public, it doesn't have to be torn apart, please just get onto the question line, put a note in the question, I think with your name, and Dave Gregory's going to compile all those little notes and produce at least some inventory of initiatives relating to dealing with injured people with mental health conditions, and we'll make that available to everybody. So just help me out with that if you would. Okay, so the Atkins scorecard. This is matched up against the areas where our research team called out where significant progress could be made. We're dealing with what I've always thought of as a wicked problem, but I was told I wasn't allowed to use that terminology in the circumstances, fair enough. But the areas where progress could be made. So here's my little scorecard. On product definitions, I don't think anything has changed in compensation schemes. You know, the definition of what is a mental illness of a different kind, of different sorts. New South Wales motor accidents has this minor injury thing, which is, it's not easy, but it is what it is. On product design, I don't think there's been any changes. I'm not aware of any legislation that now provides a different form of coverage than it did 5 years ago. There's one little exception. I don't know if there's any Taswegians here, but the Tasmanian government changed their compensation law so that for public servants, PTSD was presumptively work-related. So if that's the extent of the legislative change we've had on product coverage, that's pretty minor. There was a lot of talk about underwriting guides. Now that's not applicable in our sectors because there is no, it's a universal coverage. There's no actual underwriting per se. And then early treatment that focuses on recovery. Now, you know, this is probably the single topic that gets talked about most. Actually, that's not quite true. There is one other. So what have we got? There's a move back towards provisional liability, which I personally am pretty sceptical about the effectiveness of provision liability. That's just me. I mentioned the New South Wales motor accident scheme, so we've had a move there to more statutory benefits, not for reasons of dealing better with mental ill health claims, but to reduce the premium. There are new approaches being tried, quite often by government agencies, where and Mick's can probably talk a little bit about this from his emergency services background. Now, I think it's great that things like that get tried. I don't know how effective any of them actually are, and maybe it's early days, but I do think I follow what Walshy said about being willing to put it out there and make a public evidence base for people to work from. Too much anecdotal stuff about, oh yeah, this was great, or that was, you know, a failure. We do have specialised rehabilitation services now. You know, this is perhaps a bit of a blunt comment, but the 5 years ago, the rehabilitation providers had no more capability in this area than any of the rest of us. Now, there are specialised people in some of the rehabilitation outfits, and there is a bit of a use of mediations, particularly in work-related, where there's attempts to get worker, employer at a mediation table. Now, again, I have the view that it's mostly too late by the time it gets to workers' comp. These are HR and industrial relations issues principally, but nonetheless, that's an interesting initiative. I've just noted there, would a register of initiative and experiments help? Okay, last slide from me, thank goodness. A review of the laws would really help. Now, I was kind of hopeful that the Productivity Commission might tackle that. Productivity Commission can be very influential, it isn't always, but so far in their interim report, nothing that I can see about that. The next one is data, and reasonable progress is being made in different areas, both local and national. I feel quite sorry for the people from Safe Work Australia because they've got the world's most dreadful job trying to herd the cats of everyone from around the rest of the country, but they're working hard at that and progress is being made. People who are in the business say, yeah, okay, so you know the claim and you know its start date and its end date and when it was reported, but we don't really know nearly enough about the psychosocial circumstances of the person the more granular processes as their claiming experience proceeds. Specialised skills. I think there's been pretty good progress there. We heard a lot of people talking about specifically skilled people being included in claims operations and triage. Probably some of you have done the Super Friend training on looking after yourself and your own staff, which is a kind of nice starting point. Expert neutral evaluation. There's a couple of places that have got the provision for this, but nothing's happened at all. We're no further on from dualling doctors in this area than we were 10 or 15 years ago. It's just that the dualling doctors are now dealing with something that's completely reliant on self-reporting and much more subjective. It's quite different from doing an examination of a back injury or a broken elbow. And on education and collaboration, I guess it's a starting point, isn't it? But the amount of attention that's being given to these sort of series of issues, that's got to be a good thing, doesn't it? But it's still pretty early days because, personally, my own prediction, I can't see trends in volume and difficulty of claims turning around anytime in the near future. I think it's still going to go up because of awareness and reducing stigma and people being more willing to seek help. We do have the collaborative partnership, which is a good initiative. Slow to do things, but then it's the federation, isn't it, that we've got there. And interestingly to me, such a lot of the people have turned their focus to employer-based prevention, healthy workplace. Now, I guess that's kind of the ultimate, and I have no problems at all with the idea of working harder at that. It's a long, slow process, and at the same time, we need to deal with all the people for whom it didn't work or hasn't worked. So I'm not trying to denigrate that initiative at all, but it's aiming for a different thing. So look, that's my little scorecard. Please, as I said, if there's stuff that I'm not aware of, which there's heaps, send it in, and I shall leave it to the rest of the panel.